forcing something through a very tiny hole.
Okay.
It scatters, and then the vaginal tube tears up. You have start having tears. Some may lead to bleeding after death. And postpartum hemorrhage is ranked as the first cause of maternal mortality. So when it starts like that, luckily for her, she had just a cervical and a vaginal tear. Sorry. So the doctors were able to suture her in time and stop bleeding, and she came out well. But then another cases kept coming and coming with enema. That's the traditional pumping that they usually do. And when they come, you ask them, they'll refuse. That I no pump. So I just think we have a lot of work to do.
So at the end of the day, you realize that the self-medication thing is really rampant, because in as much as when I was talking to some people, talked to the doctor even in Yaoundé, she was like, self-medication happens at every level. Even doctors, we sometimes self-medicate, and that's why some doctors die. Yes, sometimes because they do self-medicate and they made self-medicate wrongly. She said, but one particular group that self-medicates a lot, that she's so hurt, is the pregnant women. The pregnant women self-medicate a lot, and for that she does not really know how they're going to curb it. And I love the fact that you are here to sensitize the public. So aside from the pregnant women, do you think the youths are also prone to self-medication? Because we have so many people who are drug abusers out there. I think you all started like so, right?
Yes, it did. Well, youths are very much prone to it. Like, let me use myself as an example. While I was in lower seat and upper seat, I had constant headache. So I did not think that maybe it was because I was overstressed or I was dehydrated that led to the headache. So I complained, and my mother, on visiting me, brought me a carton of paracetamol. So I kept on taking paracetamol. Now when I got here in Boya, my second year, I had drug resistance.
Okay.
Paracetamol doesn't work on me anymore, because my system has become so used to it that it has no effect on me. So I think that is the case too with our youth today. Some will go to Google and actually Google search. That is another reason why people self-medicate.
If you want to talk to me directly.
Everybody has.
I don't understand. Just call my name. Don't just call my name, Mano. Just call my name.
I'm sorry. People have access to internet, and once they start feeling any signs or they start having symptoms, they go to Google. They don't think it wise to go to the hospital, and they forget that Google is a platform where everybody is able to. I can put something on Google. You can put something on Google.
Okay.
Yes. So you just go there and then you pick any information, and then you start self-medicating yourself. Forgetting to read. Some will not even read, because when you search something, they will add other questions on that, like what are the side effects. You will not go there. You go to the drug. I have headache. What can I take for headache? They write there, maybe paracetamol, and that is it. You end there. You collect that information. You buy the paracetamol. Now there are other youths that know. For example, let me use tramadol. Overdose of tramadol is a substance abuse. Now people know that if I take this overdose, I will become addicted, but they still go in for it. So like I said, and I'm still repeating, we have so much work, not just sensitizing the old, but then we have to target the youth.
The old too, because sometimes the old are the reason why the young are taking these drugs. Imagine you feeling sick in the house and your mother is like, I feel like it's malaria, go. And your mom is even the one who goes and buys these drugs and brings to you. And over time, you've been taking this particular malaria drug. And then when you become resistant, which is something I think you'll still to get there, your mom now changes it. I sat with my friend and she told me that we can try this other antibiotics. She buys. She goes, and if they say it's 20,000, she will buy. But if the doctor were to prescribe a drug and it's 20,000, these doctors and their exaggeration.
Get money.
Yes. Our moms, no, they are terrible. Our moms and our fathers, grandmoms too.
Yes. I actually met this lady at the hospital. She went to the pharmacy to get medications, and by the time she came back, she was so furious, so angry. And I asked her, Mommy, what is wrong? She said, I don't know all time while the camp for medicine price for hospital price for medicine don add, I no know what I go do. I no go come hospital again. I go for work, go buy my medicine. I should don for my house and drink her. I know say I go dey fine. I laughed until I was like, no mama, I had to pacify her, talk to her. She said no, it is not normal, it is a government hospital, so that even supposed to give it to us for free. And I was so shocked, and I was like, if you have to take 1 kg now, will you take that kg for free, or you will pay for that drink? She said she will pay. I said it's the same thing now, you have to prioritize your health. And she's like, my pikin, I don't hear. So when you talk to them, they'll gradually, they may not accept at first, but then slowly they'll get to understand that it is important. And now there are other reasons to why people self-medicate.
Okay.
Now we have the incorporation of traditional medicine or herbal medication.
It was the medicine our parents grew up with. You won't blame people, right?
I really won't blame people, but time is changing. And now the problem with this traditional medicine is that you don't know the dose. Like for example, if you go to the hospital and they prescribe you a medication, they will say take 1 tablet morning, 1 tablet.
And it's usually based on your weight, your height, and all of that. Yeah.
That come into place when a doctor is prescribing a medication. But with traditional medicine, you don't know what dosage you're taking. You don't know.
No, but the traditional doctors sometimes say take 1 cup now. Is that not a prescription? 1 cup. The 1 cup is a prescription now. What is this kind of thing? It's something they say take a cup or take 2 cups or something. They say okay, mix. It's prescription, my sister.
I don't really know how to say this one, but I, for one, I will not really encourage traditional medicine, though it may work. But then, at least you should be able to know the diagnosis.
Now, when you say you will not really encourage traditional medicine, from an anthropological point of view, I would buy with you 50% in the sense that back in the day, we did not have the kind of pollution that we have today.
Yes.
Back in the day, we did not have the kind of chemicals emitted to the air, land, and all the destruction that we have now. So, the masepo that you knew back in the day, because even if you look at the guava trees today, if you've chewed guava leaves before, go through a guava leaf today, there is a slight change in the taste. Reason being that even the water now is polluted. If everything now in our lives on land, in the air, is seriously polluted. So if you are to take traditional medicines, you should be ready for serious side effects.
Yes.
Serious side effects. Seriously, because at the end of the day, these leaves, yes, they are prepared naturally and all, but then again, you get, like, I cannot explain everything, like, because I've seen someone who brought a traditional medicine that he just prepared. The combination is actually what we know, and it worked perfectly. But now, when this person took it, he started complaining of stomach ache. Upon getting to the hospital and proper diagnosis and all, they realized that the concoction had the bacteria, which of course that man could not treat, because you just have to wash now, you squeeze the water. So he did not know that something had climbed on top of one of the leaves, even though he washed it off, but the thing had already infected the leaf. So when he squeezed out the juice, which is as natural as possible, the person consumed, and that was a problem. And they said the thing had grabbed onto his walls. They had to go in for serious, high dosage of antibiotics and one other really horrible drug like that. And they were scared because he could easily get addicted to that drug, because the whole thing was... So I buy to your idea 50%, but the other 50%, come on now. It's what we know. It's what we know.
I understand that too. And that is true, because with these our modern medicines, Western world medicine, we have leaflets, and on the leaflets there are...
How many of us read the leaflets?
That's the problem too. That's another very big problem.
Can you teach us how to read that leaflet?
Because it's clearly written the side effects, and they will write it again that if you witness or you have any of these side effects, you have to report back to your physician, so that they can either know how to change the medication or know how to cure that side effects. But then how many people read this leaflet? How many people take into consideration the fact that traditional medicine has its own side effects? And
I've actually read a leaflet of one drug, doxycycline. It was given to me as I was prescribed because of an infection, and I cannot tell you, doxycycline has the worst side effect: nausea. The nausea that the drug gives you does not have any. You can think you're pregnant. Yes, you can actually think you're pregnant. You can think you're sick. It makes you feel sick, gives you nausea, gives you chills. Like your entire body system shuts down for almost 15 minutes before it picks up again. And do you even think the drug is not even that effective? You can imagine. Anyways, continue there.
Okay, I have this other reason why I think people self-medicate is because of accessibility to health centers or hospital. Now we have people in the rural area. We will not really blame them if they self-medicate. They don't have health centers that are fully equipped. And even in urban centers, we have urban slums, like people that live very far within. You will not even believe that that place is a town. So how, when they don't have access to health,
the means to go.
Yes, the means to go. Maybe it's because of the road, or there is no health center at all. Now these people will be forced to self-medicate with the use of their traditional medicine, because they will say that's what has been working for them. And also, sometimes people don't want to go to the hospital and wait because there is a queue for consultation. Imagine you come in, the doctor, let's say you have to be there at 8, but unfortunately you come at 10 and there are already people, about 20 people.
No, Zoe, don't say it very well. This one I don't buy. You know why you're laughing. Sometimes you go there at 6, the doctor is the one who comes at 1. So sometimes the self-medication will blame you people now.
It's a two-way.
No, there's no two-way anything here, because sometimes we come at 10 because we know the doctor has not even come.
I'm telling you, and unfortunately you come and you meet people that have been there before.
We have been there before, and then before the doctor will attend to you, you are feeling so drained. So this one that you see self-medication, you are at fault.
we both are at fault.
If it is hospital owned, it's only the doctors that are at fault. The doctor should be coming to work at 6 a.m. Doctors be there at 6 a.m. go on break at 1 p.m. Then you close now at 7 p.m.
Oh, okay. I hope they are listening.
I don't know. I'm just trying.
I hope they are listening too. So I would say perception of the mildness of a disease too can lead somebody to self-medication. Now you might think that this thing that I'm having is just small. If I just take this medication now, it will just go away. And sometimes when we start taking medications like that, maybe there is a disease and then we are masking. You don't know that you're actually masking that disease by
like you're keeping the other one, suppressing it.
You keep on suppressing. Before you know it, the disease has gone so bad that I don't know how to put it. But then I think that ignorance and I would say inadequate income or finance.
And what about fear of stigma?
Fear of stigma. That's true. In a case, for example, let me say someone that has been diagnosed of HIV. For that person to go back to the hospital, because once you're diagnosed, you have to be on antiretrovirals immediately. And if you take that drug effectively, you're able to live as a normal person. But then you go for that person to actually make up the mind that I want to go back to the hospital.
So you just make up your mind that HIV is just like malaria, because malaria is in our body. That's the thing. You understand? Like I was having a conversation with a doctor. He said the day people will realize that HIV is like malaria, that is in your body and it shows up once in a while, then we'll be better. Because when you have malaria, it's easy for you to stand, you sing it. But when you have HIV, it's like you feel
your own has finished.
And the doctor was like, to even think malaria kills faster than HIV. With malaria can just spring up to dance tomorrow you're gone. But with HIV, you can manage it.
You can manage it.
It's not even that you can manage it. With HIV, you can live well. But with malaria, there's no managing, there's no living well. If you don't take the right dosage, you're gone. So at the end of the day, which one is worse?
And it is a primary cause of concern, in pregnant women too.
Right? Yeah, I heard that there's one lady who was pregnant around my neighborhood, and she was feeling kind of dizzy or so, always like feverish, and the neighbor told her, go to the hospital.
Yes.
We don't want to hear that you have malaria because it's terrible for you. The husband was like, no, it's common. This thing that people marry men who also think that they know. Husbands people are the cause of some problems. The husband was like, no, that mama maybe they obey the sister hospital be there, maybe they born fine, blah 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 blah. My dear, the lady sat in the hospital for 1 month before she came back, just because they finally realized that she had malaria. And it was at a later stage.
Yeah, so once you're diagnosed of malaria, you don't go home. Like, I've been on internship. As you're coming to the hospital, first they give you a lab form. You go and test, especially if you're complaining of fever. But then there are other things that come into play to cause fever. We also have urinary tract infections that people even ignore in pregnant women too. So when you come,
Wait, when you get pregnant, you easily get infected with that.
normally as a woman you're vulnerable. Now you have two persons inside of you. That means your immunity is suppressed.
Okay.
So you have to be very careful. That's why you see ANC, they always talk about hygiene, nutrition, because they are two now, and you're very susceptible to diseases. So you need to really take care of yourself. And I saw this woman, she was really sick, and before we knew it, it was malaria. They had to place her. I came back to her and I asked her, "Mommy, you done the 16?" She said yes. I said, "Why you no cows?" She said, "Mama Sato say they go, Majo go buy medicine for what? Majo go buy me now malaria no. Majo go buy medicine for what?" I don't know that's so it is. We had to talk.
You are not enough. How you know? These people go to school. Imagine going to school for how long have you been in school?
I'm in my third year.
And some people go for 7 years.
I'm telling you.
And after that, they still have to go again for another 3 years. After that, they have to give for another 5 years. And you have been sitting at home. You have just no insult, sorry, no disrespect. You have just first school. You're sitting at home, and you want to do what? You want to know what somebody is. Someone has been studying for 15 years and still does not know. Because sometimes even the doctors are like, I think they are thinking. They're just guessing. And they've been studying for 15 years. It's horrible. Yeah. Anyways, ladies and gentlemen, let's get Sharon to rest a little while. I mean, she's been talking for long and she's very fluent. And the information is just coming out, flowing like rivers of living water from her. Let's give her a few minutes to rest. Today, we're taking no messages or calls. I could see some people struggling. We're sensitizing. On Friday, we're coming back with this same topic. Now, on Friday, I am hoping that we get a doctor, as in doctor, who can now answer your questions. Sharon is here to sensitize you about self-medication. So take it away. We'll be right back.
Got them at the big doctor. My mama deny you, say you no get woman, I buy choose. Your friends them they love you and they use you and they catch cruise. See, I don't care about your past, I only care about your present. Cause no one else is perfect. They say you no go school and you no books, say you be fool. And them boys them they confuse you with the juice, you open food. See, I don't care about your past, me I just want it for your future. Cause me self I'm not perfect. So I go start teach you from ABC till you reach university. Give you everything you need, girl, do you believe me, my girl? I'll never leave your side, I'll never leave your side. The world needs you, that is why you are here. And I need you, that is why I am here. Don't bother what to say, cause I don't really care. I always will be there. The world needs you, that is why you are here. And I need you, that is why I am here. Don't bother what to say, cause I always will be there. And I don't really care. See, anytime you line in a trouble, I will fight for you. And even when you know they are wrong, I will pray for you. And when your friend are gonna leave you, I will stand by you. And even when you feel so lonely, so my baby no mind. They say beat that in them no fine, but beat that color fine. So I go call my mingwa in my son, make it pull up with palm wine. So make we dance and dine. Girl, I know they lie, we can go offline. Cause I got you, baby, ask God, Emma. So I go start teach you from ABC till you reach university. Give you everything you need, girl, do you believe me, my girl? I'll never leave your side, I'll never
Hi, welcome back, beautiful viewers of High Television, and we are still on to Focal Point, where we're talking about self-medication. So if you're just tuning in at this material point in time, that's what we have been talking about. We've defined it, we've gotten to scenarios, situations, and all. Like I said, for those of you who are just tuning in right now, we are doing more of sensitization that there is a phenomenon in our society which has to stop. We have to stop self-medicating. Now, when we come on the next edition, we are hoping that we're going to have a guru here. But then we'll be taking on your calls and your messages, because right now, as I said, we're just on to the sensitization. Now, let's get on to the disadvantages of self-medicating, which is actually the core of the program. Sharon, can you kindly tell us some of those things that we do not know we are causing to our beloved self by self-medicating?
So I'm going to list a number of disadvantages, and I'm going to begin with incorrect self-diagnosis and medication intake. Now, like we previously said, people, you don't know what you're sick of, but then you're taking medications. Now, diagnosis is like finding out what exactly is wrong with me before I take in a particular drug, so that I can treat that disease or that infection or whatever it may be. Now, another disadvantage that we have with self-medication is delay in seeking proper medical advice and proper treatment.
So let's stay with the first point that you raised about them not knowing what you are sick of. Now, someone said, I don't have money, I can't go to the hospital to find out what's wrong with me. Can we have free consultations? Because only the consultation at some hospital, Sharon, take it back to your people, it's so costly. I want to go consult and they're telling me consultation is 3,000. I've not yet done any test though. 3,000 gone. And then they wait, sometimes consultation is 3,000 plus the book. The way you're going to see now the doctor is 10,000.
Especially when it's a specialist.
10,000, that's 13,000. Oh, I've still not even know what is wrong with me. 13,000 is off. Then I go sit now with a doctor who does not even look at my face. His head is down, writing history of drugs. What do you say you feel again? Doctor, I think my neck. 5 drugs for your neck. Doctor, I feel like my stomach. So at the end of the day, so you're taking your book. You are in debt of like 500,000. Now, so how do we help these people? Because if I know that I can go to the hospital even 2,000 first and I'm able to get a proper diagnosis, even if I cannot buy the drugs at that time, the doctor could give me a cheaper drug that helps curb the effects or the symptoms, and then subsequently I get to buy.
Okay, so let me try and answer that. Sorry.
Fine.
I think the doctors now sorry.
It's okay, it's cool, take your time.
I just think the doctors will have some kind of seminars, or the states can probably subsidize.
The state does not subsidize.
Can subsidize so that people who are not very much financially stable can at least afford basic medications for themselves. And I think that's the best that we can do.
All right.
I don't know about free consultation. I'm not a medical doctor, so
yeah, because
I'm not really saying much about it.
Free medication, like give us the general practitioners every Wednesday, free consultation. Government, seriously, people have to sit up. We are self-medicating and doing a lot of harm to ourselves because people are not sitting up. Sit up. Give us a day free consultation at all the government hospitals. But when they say free consultation, don't go and give me a diagnosis because you want me to come and sleep in your bed. Because these doctors of today,
you have to always find a way to balance.
They are very business inclined. I don't know if they are doctors or business people. Anyways, we're moving on to the second disadvantage of self-medication,
which is delay in seeking appropriate medical advice and proper treatment. Now, you have self-medicated yourself. Some people don't find it necessary to go back to the hospital to actually find out what was the cause of what I took medications for. And we constantly find this. They just continue until it becomes a habit. So if you are self-medicating, you find it that you'll be reluctant to go to the hospital, and your excuse will be like we talked about the queue in consultation. I don't want to go and stay in the hospital, especially people that are very busy. A person cannot clear the whole schedule for a day just to go for consultation. So I think delay in seeking is another disadvantage. Another is potential adverse reactions. Now, there are drugs that are not good for your system. Every individual is different, and we have different compositions. Now, how will you know that this medication that I'm taking is going to work for me? Now, during consultation, you're asked, do you have any allergies? Have you witnessed? They ask you this question so that they know.
Have you taken any drug prior to coming here
to the hospital, so that they know how they are going to prescribe to avoid these adverse reactions. And also, I mentioned earlier that some people that self-medicate are actually masking the severity of a particular disease without even knowing. So this is one very big disadvantage of self-medication.
Someone heard that point and was like, what? What are you saying?
You're probably thinking that illness or that disease has gone for that moment. You don't know that that illness is actually preparing to come back in with a stronger force. And
the disease is not like the devil. They say cast one out and 7 come back.
And you even require more income than you would have spent if you would have gone at the beginning. Yes. So another one that we've talked about this is more common among the youth. We have risk of dependence or abuse.
Okay.
Yes, people just get. Let me use my father. My father has
disclaimer, please, Daddy. I was not on set with her. She decided all alone.
Has a whole table of painkillers.
Okay.
If he has headache, he goes to his table.
I'm going
to take this once a day, one morning. In the afternoon, if I have headache. So he became so used to it that whenever he felt pain, that medication will not work. He told me openly, I'm going to go and look for another painkiller because this pain cannot kill me. I said, Daddy, go to the hospital. He said, my pikin, I will go. So when I finally got into midwifery, and one thing too is, if you're in a medical field in your family, you're automatically
the doctor of the family.
Even if you're in year 1, you don't know anything about medication.
People start
calling you, and if you advise them to go to the hospital, my kid, you really studying and waiting for that school. I've explained to my father countless times that in as much as I'm in the medical field, my specialty is midwifery. So I mostly deal with pregnant women, and even at that, there are medications that midwives will not prescribe. Yes, the doctor prescribes and then we administer.
Okay.
So I think that's one disadvantage of self-medication is risk of dependence and abuse among the youth, like we have said. Overdose of tramadol, people start. And there is this new one that I see people walking around with cannula. I don't know if you're witnessing.
I saw that people do that. I don't understand. What's that?
It's very rampant now. They go to the hospital and they say they have a medication to take in the house. Now, and it's an infusion, liquid. They have to pass it through the vein. Now, one of my lecturers actually warned us that if anybody comes to the hospital and that person says he or she has a medication in the house, tell them to go home and bring that medication so that you see it, you read it before. If there is need for a cannula, you put it there, and once you're done, you remove it. Because youth now use it to take in drugs.
Whoa.
Yes, that's a new style now. They send it directly into that way. You'll see somebody, the person is very okay, very fine, but he or she has a cannula.
I've seen that down the streets of Moluku, and I was like, but why do you even move with the cannula? If you're not well, sit down, take your drugs. When you're done, because I feel like that thing is first very vulnerable in your vein. If someone were to hit you by mistake, what happens to you?
Like bleeding. And if you do not know how to manage bleeding early enough, you fall into shock, and then consequences start arising. So I think that's another call of concern.
So it means anybody we see on the street with cannula, we shall look at you like this. What are you doing with the cannula?
That's what I'm saying. But then,
except you're going to the hospital, maybe you're going to the hospital. Yeah.
Yes, he has to bring it. The nurse or whosoever is putting on is picking the vein to know that I have this medication to pass, so that they know that cannula is for that medication.
Okay.
Yes. So Another one is we have dangerous drug interactions. There are drugs that we cannot take them together. If you are taking this, but sorry, I not bring any examples. If you are taking a particular drug,
Like actually I heard of amoxicillin and doxycycline. You
Okay.
cannot take them together because amoxicillin is actually, from what I learned from the doctor, amoxicillin it kills bacteria, but doxycycline actually inhibits the growth of the bacteria. Now, if you read that very well, it means you can possibly take the two because one is stopping the growth and the other one is killing the bacteria. But then the doctors will tell you never to take the two of them. Why? Because doxycycline is actually stronger, although amoxicillin is the one that kills the bacteria. So what it does is that it's going to hamper the effectiveness of amoxicillin. So it's not advisable to. I'm sorry, amoxicillin. You want cycline again? I don't know what to say. Oh, there's a cycline and there's a cycline somewhere. Yeah, amoxicillin and whatsoever. So you cannot take the two of them. So that's the example I brought for you.
all right, thank you very much.
Welcome.
Well, another disadvantage that we have is worsening the condition of the individual who is trying to self-medicate. Now, you might be sick, and then you know that if I take this medication at this point, I'm going to be well in quotes. And instead of being well, you become worse.
Okay.
It worsens the situation. So there are a lot of other disadvantages to self-medications that people really need to pay much attention to and probably seek for proper diagnosis. And I have a lecturer that does consultation online. Like she has a foundation that you can just something clearer. Yes. So I think if we can also create like platforms where people, because most of us we are on our phones, technology is taking over everything now, where you can easily have a doctor online where you can lay your complaints, consult and everything.
Yeah, I've done that with Ashumata. I remember.
Okay.
So this is what used to happen to me, and I did not know that it was a problem. When I wake up from bed, I just jump up and I'm gone. There was a day I jumped out from bed and I was dangling. Then my head, the pain. So I didn't know who to turn to because I actually have an uncle who is a doctor, a friend who is a doctor, but you know how busy they can get. So I know Ashubata is only for pregnant women. But so I was like, no, before you even specialize, there must be some general knowledge. I reached out to her and she was like, please tell me about your daily routine. And I said, that I just get up from bed and I go. She said, no, you don't do that. When you wake up, you need to rest a little bit on the bed before you get up and you start doing your chores. And even if you maybe, let's say something just prompts you wake up and you're going, take a few minutes to stand, let your body actually realize or actually wake up, because there's a syndrome, they call it the lock-in syndrome, where you can wake up because of that shock. You wake up but you can't move. Your body locks in because your body is still sleeping. And to some people, it goes on like for years. They are unable to wake up. So when she said that, I was like, Jesus wept. And then to think, she said that thing to me, and I started, making sure that when I wake up, I rest a little bit. There was a little girl in my compound. She woke up from sleep. I think someone screamed in their parlor. So she just woke up and she was going. You could look and see the little girl dangling. So I immediately remember what Ashumata told me, and I pulled her and I was like, wait, stand. She held me for a while, then she was still like, and I was like, no, just stand, just look at me, stand, close your eyes and stand. She closed her eyes, and about 5 minutes she relaxed, and I was like, wow. So I just consulted for free, and I can now help people because I've consulted with someone who has helped me. And so that point is really good. If you could have people who have this knowledge in our phones, you just explain to them what you are going through. Be truthful. Don't say you ate egg and spaghetti when you ate befukon and beans. Please tell the truth. No, that's the truth. Some people will tell you a different thing, and then you are given a different diagnosis too. Tell the truth.
And when it goes wrong, na doctor be to say my And now to pregnant women,
the most important people.
I'm going to talk about the disadvantages of pumping. Let me say pumping.
But why does that have a disadvantage?
Some people pump with hibiscus flower.
Where did they see it?
Do you know the composition? My grandmother said.
What about guava, masipo, okra? Some people pump with okra that it helps the baby to slide. Is that true?
All those things are myths. Maybe it worked in those days, and I don't think they work now. But being on internship, I've mostly seen women that come with the complaint that they pumped with hibiscus flower. So it has so many disadvantages, and it might disrupt the development of the embryo. That's if in early pregnancy you start pumping, your child might come out with structural and functional malformations like low birth weight. You give birth, the normal range is 2.5 to 3.2. That's the normal range of a baby. Now,
So where do we have those ones that come for?
those are big babies or macroscopic babies.
Because you have a baby that
Yes.
4 kilograms. Like, what were you eating in your mother's womb?
Big baby macroscopic babies. Yes.
Okay.
So we have low birth weight babies, and it might even lead to the delivery of premature babies. Like, you will not like to see a child suffer. Presently, I'm working at the neonatology where we receive premature babies, and
It's heartbreaking.
it's really heartbreaking. But then there are other factors too that come into play, maybe this or that, yes. But then the use of enema is one of them.
But what if a lady actually did the enema before realizing she was pregnant?
As she
Like-
has to go to, because they always have consultation. It's not like they have rendezvous with their doctors to make sure that the pregnancy is followed up. So it is in a woman's place to tell the doctor everything. You have to confide in even the midwife.
You
Because
tell her
yes,
everything
yes,
you've
tell
been
her
doing
everything.
before you discover you were pregnant.
Yes.
So what if I was taking a drug that says not for pregnant women?
You will have to stop it. If you go to the midwife and you tell her that this is what I was taking this before pregnancy, but now that I am pregnant, should I? They will say no, you should stop it. Maybe the doctor can prescribe a substitute if that condition is still there. They can prescribe a substitute to what you will take so that it will not affect you nor the baby.
Okay.
Yes, and some another disadvantage is that it may lead to uterine rupture. Now, when you let me explain, when you take this pump, when you pump, now it increases the level of contraction. Contraction is what helps the baby to come out. Let me put it like that. So imagine that your uterus is constantly contracting, and then you're feeling so much pain. At one point, it will break. That's why they call it uterine rupture. It will break, and then the baby will be forced to come out. Like we talked about cervical tears and perineal tears too. So we also have your baby might come out with respiratory distress, respiratory problems, malformations because of what she took. So pregnant women, we really need to be very careful. Pregnancy is a normal thing. It has a normal pattern that it's supposed to follow. But now there are situations that some things come into play, and then if you're being followed up by a doctor, we can manage that and then prevent adverse consequences to be extreme. Yes. So those are some of the disadvantages.
Okay. All right. Now, there is one particular disadvantage that I know you've not yet touched. That one of being resistant to maybe antibiotics. And I know somebody, I've worked with somebody who at some point could no longer take, I think, almost half of the drugs that exist because she constantly took those drugs at some point. So at one point now, the drugs, like her system is just resistant. Why will my body even first become resistant to something? I don't understand.
Okay, so let me define what drug resistance is. It is when a cell or a bacteria becomes less sensitive to a specific drug because the bacteria or fungi or the cell have developed the ability to defeat that drug designed to kill them instead. So, okay, let me explain. If you're taking
No, you have to really explain. Where does this infection get the momentum from to develop resistance to something like, I don't understand. This medical field is so difficult and complicated at some point.
Okay, so if for example you're taking an antibiotic to solve a problem, an infection or anything, and then you've taken that antibiotic once,
Yeah.
it worked, twice, it worked. With time, as you continuously take in that particular antibiotic, now your cells, your bacteria in your body are already used to that if I am sick, they're going to give me that particular medication.
Okay.
So they are building immunity against and resistance to against that medication. That's why at one point it does not work again. You just find that they are instead killing the effect of the medication that you're taking instead of the medication killing them.
All right. Thank you so much. That was good there. So we have to stop self-medicating. You don't know what the drug you're taking is doing. Probably that's the reason why you find yourself sick of malaria. You go to the hospital, they give you the first study, it does not work.
Yes.
They give you the second study, it does not work. Malaria that someone has gone to the hospital today, they've given the person the drug, the person is already sweating, the person is already feeling better, eating. You have been there for 1 week. You're treating malaria. It's not going. Now, probably because you are now very much resistant to the drug they're giving you, or you have been self-medicating with a drug that actually now counter interacts with the drugs that you are taking. So this goes a long way to begging. When you are sick and you go to the hospital, make sure to tell the doctor the truth. The doctors will always ask, like she said, what did you take? Have you taken anything prior to coming here? Say yes. If you don't know the name of the drug, that's why this nurse at one hospital around Sanpi said, when you're going to the hospital, take your hospital book and any drug, if you don't know the name, just carry the drugs, and when the doctor asks, just present. The doctor may look at that drug and realize that maybe it's because you're taking 2 of them at once, that's why you're not feeling fine, or you're taking them in some people overdose
or not even taking up
not taking up to the dose, because you cannot be, let's say you weigh 90 and you're taking 1 tablet. No, it won't work. When you reach a certain weight, it starts getting to 2, 3, some people even 4, because your weight is what's really maybe has to contribute to your health. Now, she talked about the roadside vendors. I think it's a big problem. Like you said, we cannot know them all. Presently, you and I are here, the markets are there, and they are not watching, they are not listening. And someone now at the market has just bought something that they have said, it cleanses the stomach, it will help you go bump picking, you are there taking. And you're, every day you're looking for a child, the child is not coming, you've forgotten that you bought something one day along the road of Mutengene, and you've been drinking. Who prescribed that? Who did that to us?
I don't know. I don't know. I think more and more campaigns has to be organized.
Are you telling us, or you're talking to yourselves?
I'm talking to myself.
Okay.
And to my colleagues.
Yes, people have to.
We have to. And with For Mom and Baby, we're already working on that.
Yeah.
Yes, we are working on that with our pregnant women in some health centers. So, yes, we've visited a lot of health centers, trying to curb down the rate of maternal mortality. So, because that's another call of concern. You cannot be wanting to bring life into the world and then you're losing your life. So it's really, but then sometimes too, when they organize these campaigns, people don't attend.
No, because there's no free savon.
Yes, there's no free savon, there's no free rice, there's no juice. So
they don't know that the health is the better juice and all of that. But also it's sometimes because we do not know.
Yes,
we don't know, because if we know, I mean, who wouldn't want to be healthy after bringing forth a bouncing baby girl or a bouncing baby boy? You want to be healthy. You want to take care of your child. I mean, you're looking at society and you're seeing how other women treat kids that are not there. So you wouldn't want to bring forth your own and you two are not there. So I think it's more of when you people have these campaigns, get to a public space, like let's say, okay, the stadium, just out there around Checkpoint. Everyone is going to see you. And use microphone so that even if we are passing and we want to be playing the loudest music, the mic is still going to penetrate and we're still going to get it. Because sometimes the people who even come for your campaigns, who sit there, don't even carry anything back home, but somebody was just passing, picked a thing or two and it changed their life. So people should learn, use banners, use media outlets too, because you people want to do the free campaign does not mean you will not pay for your campaign to be create some awareness about the campaign there. Use banners, use microphones, use flyers, use even the journalists around, let them talk, let them bring the people together. That's how we are going to better the society.
I'm going to take back home.
I like that. Now let's talk about these roadside vendors. The increase, because now Cameroon is a country, especially where everyone wants to survive, and so everyone wants to get into something that will bring quick turnover. And one of those things is medicine. Why? Because people are always sick. People always have a malaise they want to relieve themselves from. So we are always going to have very small chemists. Yes, you have the chemist. You have that mommy for backside day. So former nurses too, and doctors too,
and students, nurses, student doctors. In fact, everybody.
That's why I say self-medication is a broad something. And today, as I said, we're just sensitizing. When we come next, I'm hoping the gurus will be here. Let's curb this particular situation. So what did you want to say about the roadside vendors?
I wanted to suggest that, I don't know if it's counting.
Don't say anything that will stone you an eye. There will people stone you an eye when we leave here. Just be very careful. These are people's livelihood, I beg of you.
Oh, really? Now I'm blocked.
No, just say it. Just say it.
Alright. So I just think that instead of using that money that you have to go into medication that you know probably nothing, little or nothing about, you can use it to start another business. You know, we are talking about people's health.
You can just cook food.
Yes, have a skill, and that is one thing that is important to having a skill. Sometimes people go into business just for going sake.
I think we're also going to talk about the roadside foods at some point.
Okay.
That's another problem, especially for pregnant women. Because everything right now, I don't know why I'm so in love with pregnant women. I want them to be healthy. I don't know, but I feel like they are the reason why society continues. They bring forth our brothers and our sisters and the ministers, and also we need to pay keen attention to them. Roadside food is becoming the hygienic condition of this food, the hygienic condition of the person who cooks the food. And sometimes the person is self-medicated, and when you come to buy food, say, "Mommy, I'd get headache." Say, "No, you don't take jugo. It helped me. It's just, since I did a corner fire, so no. Everyone is self-medicated, and everybody is prescribing to another person. Let's stop that."
Okay, so, and also we can probably give notices to those people that sell at the road. Like, you have to check first. Check if they have any history of being in the medical field or something. Like, we have to check to actually make sure that these people are qualified to sell this medication, and we should go into those cosmetic stores, because I heard of a case where a girl committed an abortion in a cosmetic shop, like behind. It looks like a cosmetic shop, quite alright. They sell.
But it's a quack doctor.
Thank you very much.
It's a quack doctor who.
There is a room inside.
Doctor, wait, he has a room inside.
There is a room.
Yeah, now that brings me. It's true.
They buy very big cosmetic stores, and then they split it into two, maybe with a plywood, and then they have a small blind. If you go inside, you're going to see a bed
and a patient. Because I've seen one. Now you're bringing my head, and I've seen here in Moliko. There's everything here. I walked into a cosmetic shop, and I realized this wing is a terrible thing. the wing just went inside, and it lifted up a blind, and I could see a bed and this stuff that people use to hold the drip.
Yes.
I saw it there, so I thought maybe the person is a doctor or.
Well, we cannot really say. So that's why I said we need to go around and check to know who are those who are qualified to sell medications, because we train pharmacists. Yes, as a pharmacist, you can leave and then open up your own small clinic where at least you have a knowledge of what you're giving out to people. Yeah, but then you just know that I have small knowledge, that maybe I've done my own research. Yes. Research. So people use their phones, they go online, they research a few things, and they feel that it can be doctors. They can prescribe medications to others. And we also have these people that have very small, I don't know how they call it, but they have something that they have built. Yes, where they.
It's like you've been moving around taking notes, so there's anyways your field.
They put their medications, and then in front they sell sweets. They sell bonbon.
So you buy chewing and bonbon, and then
everybody is trying to actually cover the fact that they are doing something illegal by putting other items in front to show that no, this is my actual business. I'm just doing this one like this to help people.
Now let me ask you something. I recently saw something on social media on someone's post. The new way of getting a clean white skin is through the vein.
Yes.
You've seen that?
Yes, I have. That's why I mentioned cannula. Females will use it for a variety of reasons, and it includes
Skin bleaching.
yeah, skin bleaching, and males will mostly use it. But there are males that bleach sooner. Yes. So people just have a variety of reasons why they use cannula. And
How
most
do
of the
you
time-
I mean, like, you pass something in your vein
in
to
your
bleach your skin?
Yes, and it's very effective. That's what I've heard. That it's very effective. It does not give you dark knuckles, and it's inside your
What
bloodstream.
about the side effects? Do they know about it?
I don't know. It's inside your bloodstream, so it's going to circulate around your body and just make you automatically fair. That's how bad self-medication is.
That's how bad some, because the person who brought that drug, and sometimes the person who who has that business knows how to pick the vein. Like, where did you learn
They
that
learn,
from?
like, so they're really
Which vein are you? Which vein did they just connect? They don't even know. And it's really, we are lost for words, because at this point in time we realize that society is just going downward, just downward. What are you doing? It's already bad enough that the one you already put on your skin directly is horrible. So wait, you don't see the side effects of that one. Now you're going to your vein. How do some people look at their bodies again?
And with time, almost everybody that wants to bleach will divert into injections, because they will not want to have dark knuckles now. Everybody wants to shine too. I don't know if it's the problem with low self-esteem, or it's the problem with
Dark girls are not beautiful. I don't understand,
peer
because
pressure. I don't know what.
slap the peer pressure in the face. Who has peer pressure
I want
helped?
to be fair. I want to shine. That's another form of medication, because people have ointments that they
People
apply.
have drugs that they do take.
Yes.
There's the one they give you drink, then.
And so now I like rub your body.
And this new one, the new ones that have come, these people who they do Botox enlargement. This is all part of self-medication. Botox enlargement. Which one? Breast enlargement.
Flat tummy.
Flat tummy. You rub something, it gives you a flat tummy.
I watched a video on TikTok. They have a concoction that they mix now. I don't know what it's made up of, but it's something greenish. Now, when you drink it after 14 days, you have flat tummy automatically. I don't know what is inside. I don't know who is mixing what to give it out, but I think if I come across the video again, I would go to the comment section to know, because people will ask. And you always know how videos appear. They will put somebody's text by the side that you ask for this, and they make a video. Is somebody drinking something really green, and their face is twisting, but you're drinking it because you want flat tummy. So,
All right, I'm done. At this juncture, I'm done, because that's it. Self-medication starts from you just taking paracetamol. I will call paracetamol because it's the simplest drug, right? It's not even that heavy. Someone just starts with paracetamol, and because you have the heart, some people even self-medicate with their eyes. Like, you just stick anything, it's going into your eye, your ears.
no problem. Or if somebody has taken this particular drug, and you probably maybe in a discussion, and then you complain of something, they'll be like, I took this medication, maybe it can work for you. And then you buy it, and then you start having your own side.
No, there's nothing you can tell me on this earth that I won't ask a doctor.
You know, people are very different.
And the others
People are
said,
very okay with everything that another person says. Sometimes Google too may help. I'm saying
no, because Google told me one time I had malaria symptoms. Google told me I had epilepsy. I looked at Google and I looked at myself, like, Google was like, with the symptoms you're having, it's possible you may have your first epileptic attack. I was like, Jesus, epileptic what? And I had to rush to the doctor, and they were like, seriously, sister, what, really? It's horrible. But Google is actually Quora, where everyone goes and asks questions and people come and reply. you find
We actually have good websites.
self-medication is horrible. I was about talking about people who have facial issues. There's another set of people who can self-medicate for Africa.
Okay, acne, yes.
Those ones and self-medication 5 and 6. They can they can self-medicate. Today they'll hear that no, if you grind amoxicillin and you put there, it's going to they don't even wait.
They are always there.
They've gone and they've tried it. Then tomorrow they tell you no, you know that slime that comes from the snail when you mix it to paracetamol. No, they are there. The next second they are there.
That's very true. Your face is the first thing that presents when people see you. So everybody wants to make sure that my face is okay. At least when they see me, they start to.
I feel like a girl who has acne is more beautiful. Should be told.
Really?
I don't know. Most of my pictures back in the day that I loved are the ones that I had like acne here, and I don't know. I just feel.
No, there are degrees of acne.
No, there's this one that is fat and it goes all over your face. Sometimes, to me, it's fungi.
Yeah.
If you treat fungi and you go with the dermatologist, that's it. We don't want to consult, because if you go to a dermatologist, there's always something they're going to do that. Sometimes the swelling is because you're allergic to something, or you're eating something.
Or because of a dirty pillowcase. Hygienic conditions too matter.
You just said it all. You said it all.
Yeah.
You said it all. All right. So Sharon, we are actually moving out. I'm surprised because I didn't think we'll last up to this hour, but we're here, and we thank God. So I want you to look at your camera, and Sharon, you are someone who has witnessed self-medication. We didn't even talk about some of the extreme side effects of self-medication. It can even lead to death, I think. It can lead to infertility. I'm just thinking.
Yes, that's true.
Okay, so if we know all of that, Sharon, with your field expertise and everything that you have in your head, look at your camera and talk to a young girl, a young boy, a mom, a dad, an uncle, whoever is watching you. Talk to them about self-medication. Try to discourage them from it.
Okay, so having said all that we've said,
Okay, your camera is away.
the one advice that I would give you is go to the hospital. If you have to take, do not even think of taking any medication. Go to the hospital, meet your doctor, and explain so that you can have proper treatment, because they always say health is wealth. But now people now use it just as a slogan. They don't know the meaning and the value of their health. Once you're healthy, you're able to carry out your normal activities. Once you're healthy, you can do anything that you want to do. Because being sick, you're being vulnerable. And there are people that will not even like others taking care of them.
Yeah.
I have met cases at the hospital. I have met cases at the hospital where a patient is so shy. I don't want you to see my body. I don't want to.
Maybe because of what is on the body.
So,
But if I'm coming to you, a doctor, be ready to see you. Because I'm not feeling fine, which I want to feel fine. So you should be ready to see. So why should you feel like shy? What are you shy? Why are you shying? Why are you shying? Shying from who?
it's not easy that you're just there, you're bare.
You are sick.
Yeah.
And there's this other one that people now do, the self-medication of take this one and you will last longer. Last longer doing what? They say put what? They say there's this, they say raw eggs, and you hear people say all sorts of things. What do you want to do with that? Last longer for what? Are you running a marathon?
Yeah, so
Terrible.
the take-home advice that I have is not self-medication. Just forget about it. No to over-the-counter medications. Go to the hospital, get your prescriptions, and follow them, and then you will be okay. You will be fine.
Okay. Thank you very much, Sharon, for coming. And I'm hoping that on Friday when we have the gurus, we could still have you. We could still have you here so that the information is heavier. I refuse vehemently to take messages today. Now, for those of you who want to ask questions, I don't want you to ask Sharon, because Sharon is a midwife, actually, but she has a lot of information about self-medication, because she deals with your mothers, your sisters, and your wives, and she's seen the effects of you people telling them to take this, take that, take up, take down, as well as she's waking us youths, because as a midwife they do also have general knowledge, and they've met people for general observations and all of that. Now, what I have to say to you who is watching me right now is if I know you may not like us for saying this here, throw us, but don't throw the information. I beg of you, throw us. Do not throw the information. Life, we live just once. Life is as important as you could ever imagine it to be. We live once. Pay attention to your health. All of these guavas, take this, take that, it helps this and that. Please, no. Some of us go take those things. We don't see it now because that's the thing. We don't look at the long-term effect of certain things. You could take something now, it works perfectly, but by the time you get to your 50s, it's the reason you're crippled. It's the reason you are blind. It's the reason you, instead of you enjoying menopause, you now start suffering from papapause instead. Now, there's just a lot because we do not know what we've consumed. So please let us together say no to self-medication. I really want to say a big thank you to all of you. Thank you to the broadcasters. Thank you to Mr. Enayo Comfrey for general supervision. Thanks to you, Claudine Limbi. Thanks to Sharon so much. She was our bag of information for the day. Thank you so much. Hope to see you again. And ladies and gentlemen, it's at this juncture where we actually say our goodbyes. I want to thank you for watching. Thank you for thinking. Thank you for getting angry too, because it means we did say something which
You said a lot of things.
you said a lot of things. Yeah, so thank you for whatever emotion that this is going to awaken in you. And as I go, I'm leaving you in the company of beautiful programs still to come up on High Television. So stay safe, stay blessed, and stay connected. Goodbye.